Hi, good evening, everyone. Welcome to tonight's Brampton Tech Talks on managing chronic disease with digital therapeutics. Brampton Tech Talks are a regular series jointly presented by Brampton Library and the City of Brampton. My name is Erin Walker. I'm the MakerSpace and Digital Literacy Librarian at Brampton Library, and I'm joined by Zaim Siddiqui, Education Programs Coordinator at the City of Brampton. Thank you everyone for joining us this evening, and I hope everyone's keeping safe and well during these difficult times. A few notes: if you do require closed captioning, you can access the live transcription from the More button near the bottom right of the Zoom screen with the three dots. And I do want to let you know that tonight's session is being recorded and will be posted to the Brampton Library's YouTube channel at a later date. To launch this evening's program, I would like to acknowledge that Brampton Library is located on the treaty territory of the Mississaugas of the Credit First Nation, and before them, the traditional territory of the Haudenosaunee, Huron, and Wendat. We also acknowledge the many First Nations, Métis, Inuit, and other global Indigenous people that now call Brampton their home. We are honored to live, work, and enjoy this land. A couple of service announcements from Brampton Library. While our branches are closed to the public currently, we are offering curbside pickup from all of our branches. You can find the hours of operation on our website at bramptonlibrary.ca. And of course, you can access ebooks, e-learning, virtual programs, and more at our website as well. Something that I'm pretty excited about is that our e-learning resource, lynda.com, has recently migrated over into LinkedIn Learning. And with that comes a new interface and increased access to over 16,000 courses. And while our physical spaces are closed, we are planning for the future and are currently looking for public input into our next library facilities master plan. Whether you are a regular or an occasional library user, we want to hear from you. Tell us about the things that draw you to the library and ways that our branches can be improved. And I invite you to complete our survey for a chance to win an iPad. Zaim's going to paste the survey link in the chat, or you can also access it at bramptonlibrary.ca. As I mentioned off the top, Tech Talks is a series we run every other month, co-hosted by Brampton Library and the City of Brampton. And we really want to keep the conversation going in between these meetups. So I invite you all to join our meetup page where we post information about other events that we're hosting, and also to join the Brampton City Slack channel where you can connect with others in the local Brampton Tech and Innovation community. I'm ready for tonight's topic. It's my pleasure to introduce tonight's speaker, Daniel Yeboah. Daniel is the founder and managing director of Ellerca Health. He's a serial entrepreneur and health professional with diverse expert experience across all sides of the chronic care system. In addition to launching multiple successful digital platforms, Daniel's work across silos in the healthcare industry gives Ellerca leadership key stakeholder insight from consumer provider, pharmaceutical, and public-private payer perspectives. Daniel's 10 years of experience as a healthcare provider in oncology and rare disease nursing provided the core vision for Ellerca's human-centric approach to delivering exceptional, proactive digital therapeutic solutions that provide continuous, integrated, whole-person care. Daniel, thank you so much for joining us for Brampton Tech Talks this evening, and the floor is now yours.
Thank you so much, Erin. I'm going to share my screen. Great. Do you see my screen?
Yes, we do.
Excellent. Thank you, Erin. Thank you, Zaim. Thank you, City of Brampton and the Brampton Library for this opportunity. So 8,759 hours. And I want you to just sit there and think about how long that feels like. 8,759 hours. And so 8,759 hours is a very, very long time. And if you have a calculator and you run a quick calculation, you're going to pretty much figure out that's 365 days in a year, minus 5 hours. And so again, I want you to look at that number, 8,759 hours. And that is such a big number. And so when we think about individuals that are living with chronic conditions, that's the number that I want you to always think about, 8,759 hours. Because managing a chronic condition is a full-time job. It's something that you live with 7 days of the week, 12 months out of the year, 365 days out of the year. It's an ongoing thing. And so again, when you look at this number, 8,759 hours, I want you to consider the number of Canadians that are living with chronic conditions such as hypertension, COPD, obesity, diabetes, and just a host of others. And when you think about that number, look around you. Just think about the individuals that are on this session right now. And at least 44% of us are living with a chronic condition. And we're living with this chronic condition 8,759 hours out of the entire year. And so what I want to do is I want to share a story with you. So I was working in the hospital setting and I met an individual. And her name is Emily. And so this is Emily and her family, her husband and her 2 children. And, I spoke to Emily before and she was kind enough to share a few pictures with me because I want to share her story. And I felt that sharing her story would add a little bit of light, provide a little bit of context into a little bit of what an individual goes through. And so you see here Emily, enjoying some apple picking. They're out on the weekend with the family, just enjoying themselves. And I remember when Emily's first time coming into the clinic, and she was told that she was diagnosed with diabetes. And I quickly remember the look in her eyes. And so I remember her sort of glancing away. And then she would focus again, and then she'd sort of glance away again and come back. And I could see the fear in her eyes. And I could see the concern in her eyes. And I could see that she was thinking about something. And I could tell that whatever she was thinking about was preoccupying all the things that we were telling her. And so despite the fact that we were talking to her about new medications and therapies, she wasn't paying attention. And but her spouse was there. And it became clearly evident that there was one of the 2 individuals were listening. And as I looked at her spouse again, as supportive as he was, I could also see the concern in his eyes that he too was scared. He didn't know what to do. He had questions. And in speaking to Emily, as I prepared for this presentation, I really wanted to bring her back to the time when she got diagnosed. And one of the things that she told me is she shared this picture with me, and she said, when I got diagnosed, Daniel, this is the picture that was in my mind. I remember the picture of, am I going to be able to do the things that I enjoy doing? Am I going to be able to continue going apple picking with my family? Am I going to be able to continue to enjoy Sundays in the park? Is the relationship with my spouse going to change? Is the relationship with my children going to change? Can I still go skiing? Do I have to change the things that I do? And so as we spoke about this, one of the things that I wanted to do was bring her back again, and I asked her, I said, talk to me about your condition. Talk to me more about all the things that you experienced at the time of diagnosis. And then during the time that you were in the hospital, just having the conversations with us, and then talk to me about what that frustration like, or what those feelings were like 6 months later after diagnosis. Talk to me about what the feelings were like a year later after diagnosis. And I remember this is what she said to me. She says, Daniel, it feels like a full-time job. I have to remember to take medication. I'm tired of testing. This feels like personal failure. What about my children? What about my job? And she just kept on saying, I want to do the things that I want to do. I want to do the things that I enjoy doing most. But she saw the fact that she was diagnosed with diabetes as something that was just hanging over her head. We talked about personal failure. And when we talk about personal failure, it's, well, why? And the first thing is she blamed herself. She thought, what, this is something that I've done. She looked in her family and also saw individuals in her family that also were suffering from diabetes as well. And again, she came back to, well, did my mother give this to me? Did my father give this to me? I see individuals in my family. I'm not overweight. I don't eat cake all the time. And I remember telling her that has nothing to do with it. You see, one of the risk factors was genetics. And living in Brampton, Brampton is the city in Canada with the highest incidence of diabetes. And that's something that one of the things that we talked about in that was one of the questions as part of the Kahoot. You see, the other risk factor is who she is. You see, Emily's background, she's Asian. And when you look at the different groups, is Asians, South Asians, Blacks, and people of African descent, those are and First Nations. Those are the populations that are at the highest risk for developing diabetes. And so she was already predisposed to developing diabetes. And so it was really important to walk her through the journey and let her understand that this is not something that was her own doing. She talked about the frustrations about testing, of always having to prick her finger, of always having to remember medication. She remembers before the date of diagnosis was, I was normal before, and now I'm not. I was fine before, but now I'm not. And one of the common themes when you have conversations with individuals that are living with chronic conditions is they remember the before, which is very, very clear, and then now they remember the after. And so the after is, I can't do the things that I like to do before. And so this is what she likes to do. This is one of her favorite hobbies. And in speaking with her, I explained to her nothing changes. But you see, what happens is sometimes we get preoccupied with, what can I no longer do? And so as we talked about the pain, as we talked about her feelings, as we walked through this journey together, she brought up, these are the things that I like to do. And she clearly remembers, I enjoy making pasta with my daughter. We like to make fresh pasta. And what's so nice is that you have these conversations and you hear the very, very clear, distinct things that people enjoy doing. And then now she feels that she has this label on her, which prevents her from doing anything, which limits her ability because she continues to remember the pain, the frustration, the inability to do the things that she would like to do, the fear. All of a sudden, her life has changed. And so now comes a concept that I want to introduce to you. Is called a digital therapeutic. And you see, with a digital therapeutic, the purpose of a digital therapeutic is to bring something that's digital, generally off of a mobile device, that acts as therapy to that individual. And so prior to her diagnosis of diabetes, and anyone that also has a chronic condition, digital therapeutics play a key role in that individual's therapy, and also a key role into them leading towards better health outcomes. And so one of the things that we've done at our organization, Ellerca Health, is develop a solution called 360 Care. And 360 Care really is that solution that comes along as a companion to that individual. It's your guide. And so one of the things that we're really excited about is we were able to introduce Emily to Chriselle. And you see, Chriselle is a nurse and she's a diabetes educator. And Chriselle was able to meet Emily where she's at and listen to her. You see, when you speak to a lot of individuals, which we've done, is I don't want to go to my doctor's office and get lectured. I spoke with someone last week and they told me that, I spend 25 minutes driving to my physician's office. I spend 10 minutes looking for parking. I wait in the waiting room for another 25 minutes. I see my doctor for 5 minutes, and the first 4 minutes is a lecture about what I shouldn't do. It's a lecture about I need to eat better. It's a lecture about I need to lose weight. It's a lecture about all the things that I need to change in my life. And then that individual gets a script renewal and they're gone. And that hasn't led to positive experiences. And when you look at a digital therapeutic, digital therapeutics take the entire experience and put it back into the hands of the user, where it puts you back into control. And it puts you back into control because it changes the dynamics of the patient-provider relationship. And so when you connect with an individual like Chriselle on our team, the first thing that Chriselle does is listen to you. She wants to hear your story. And she wants to know where you are at in your journey. And when she begins to understand where you are at in your journey, the next question is, how can I help you? As opposed to, this is what you need to do. You see, when we begin to ask questions of how we can help you, how we can be of assistance to you, because maybe you don't want to have a conversation about diabetes. Maybe the thing that's really concerning you is, can I still make pasta with my daughter? You see, and if that's the key question that you have, we help you answer that question, that yes, you can still make pasta with your daughter. If the question that is prevalent on your mind is, can we still go for a picnic on a Sunday afternoon? Can we still go apple picking? And we begin to answer those key questions and help that individual based on where they are at in their journey. You see, the role that we play is the role of we're your companion. And that is the key role of digital therapeutics and how it changes health outcomes. You see, one of the things that we've done is we provided a user-centric approach. And that user-centric approach is, how do we wrap around? How do we give you that really, really big hug? And so we give you that really, really big hug by encompassing a dietitian around you. We have some health tracking. We bring on psychologists. We do some smart device integrations. There's some notifications that we also have. We do some remote monitoring. And we also have a health navigator. And all of these components come together to provide that best-in-class user experience for that individual. And again, it changes the entire relationship of the patient-provider. You see, if you don't want a dietitian, we're not going to force a dietitian. If you don't need a psychologist, we're not going to bring you to a psychologist. But based on where you are at, based on the needs that you as an individual have, then we essentially partner you with that right care provider to provide you that best experience. And so when you look at digital therapeutics, a lot of providers that are in the space will give you some type of device integrations that connect essentially with your mobile phone. So like I said before, you have a mobile app, and then there's a host of devices based on what the diagnosis is. And so based on the diagnosis, you'll probably get a welcome kit. And inside that welcome kit, it's the tools that you need to be successful. And so these tools are all connected via Bluetooth device where it's all integrated. And so individuals like Emily can step on her weight scale and it's Bluetooth enabled. And when she steps on the scale, the data shoots right back to the mobile app, right back into our data center. And then her provider, her health navigator, her nurse, her dietitian, her psychologist, her entire care team has a full 360 view of how she's doing. You see, she talked about, I hate pricking my finger. And so when she talks to us about that, we can look at solutions that better match what she as an individual is looking for. And so when we look at solutions, there's things such as blood glucose testing, there's continuous glucose monitoring, and there's a whole host of devices that are available on the market that are all Bluetooth enabled, that are interconnected, that provides better experiences to individuals. Another thing that Emily might do is get a blood pressure monitor. And we talked about the blood pressure monitor because it allows her, again, to check herself and get healthy. So let's talk about how it works. And so what the experience is like in a digital world. And so when we look at the digital experience, it's that video conversation with your health navigator where you can now begin setting goals. And those goals really are directed by you. And again, with digital therapeutics, the focus really is on behavior change. And so it's how do we provide you, again, with the tools to help you make those incremental changes until you reach those healthy outcomes that you so desire. There's opportunities to test your blood sugar, get new recipes. So if you're looking for different foods, if you're looking for culturally sensitive menus, food ideas, nutrition ideas, the mobile app environment is a wonderful place to start. And then all these things are always integrated into one mobile app and one platform. You know, you can check your activity level. One of the things that's really exciting about digital therapeutics is how it leverages a technology in our cell phones. And so our cell phones have an accelerometer all built in, every single one of us. And so when we walk, it counts how many steps we're doing. And so you might have seen on your smartphone every now and then where it says, this is how many steps that you've walked today. It gives you a little bit of an idea of how you're doing physically. You might have an Apple Watch, you might have an Android watch, you might have a Fitbit. And here are great opportunities to check your activity level, where you can see it on your device, on your wrist, but also you can see it on your device and look at how you're doing before, look at your stats. And this can be all ways to help motivate you as the individual. One of the things that's really exciting about digital therapeutics is the coaching element. And so again, it changes the dynamics of the physician patient relationship or the provider patient relationship, because we've now moved into a place called coaching. What's really exciting about coaching is think of your favorite sports team. Think of what the role of a coach is. And the role of the coach is to do one thing: bring the best out of you, help you achieve the things that you so desire. And so if your desire is to run the Boston Marathon, okay, we're going to help you get there. You might not be ready today. You might not be ready next week, but we're going to help you make those tiny incremental steps, those tiny changes to get you to a place where you need to go. Another thing is the ability to just send text messages and to your care providers. So again, in a mobile app environment, there's an opportunity to do in-app messaging. And so in-app messaging is that secure environment where it might not be so urgent right now. It's maybe a question that came across my mind throughout the day, and I'd like to get an answer. I don't need the answer right now. I could probably wait to get the answer tomorrow, but it doesn't require me booking a consult. It doesn't require me leaving my home. But I can send a message and get a response back in 24 hours that answers those little things that I need to know along my health journey. Another thing is the ability to just log the food that you eat. A lot of individuals have different mobile apps for food journaling, or you might just be curious as to what do I eat throughout the day. And so what's exciting about it is the ability to log your lunch, but also when you go right all the way back to the beginning of talking to your dietitian, because there's that mobile experience, that video call experience, an individual that's speaking with their dietitian can now take a picture of their food and their dietitian can have a quick look at it. An individual might be able to can also speak with their dietitian. And while I'm on that video call with my dietitian, I can walk over to my fridge and just show my dietitian what my fridge looks like. I can show the dietitian the groceries, or I can show them what meal am I having today? And then I can get real-time advice on how I'm doing and get some real-time adjustments. And this is where digital therapeutics really begins to shine. There's opportunities again to decompress. Where you see some really cool things is engagement. And so I'm going to talk a little bit more about engagement as we go further along in this chat. But again, coming back to healthy dinners, and then at the end of the day it helps me rest and relax. It really helps me as an individual get to where I want to be. I talked about engagement. So when we look at engagement is the ability to engage the user at the right time. And so when we look at your mobile device, when we look at how do we engage you as the individual user, is we're able to send push notifications to you, maybe just as you're pulling up in your car, or maybe just before you drive off, or while you're walking, while you're running, while you're doing some exercise. It's a notification that you get to your device that says, great job, you're doing an amazing job today. Maybe you might not be jogging and you might just get a notification that says, hey, guess what? You're 500 steps away from reaching your goal. It's that word of encouragement that says, you know what? Let me go for it. Because it's a plan that I've set up with my accountability partner, and I'm going to do my end. But guess what? When you also hit your goal of the day, the phone also sends you that congratulatory message. It sends you that confirmation that you've done it. And again, it reaffirms to you as an individual that, yes, I've been successful, that I've done the things that I've set out to do. And this is where we can see some really high levels of engagement with the digital therapeutics. Again, one of the things that's really exciting is about the fact that leveraging the phone technology. As soon as you wake up in the morning, you can get a notification that, again, it's a plan that you may have worked out with your provider that starts you on your way. And maybe it might be time to take your medication. Maybe medication might be that thing that you as an individual is looking for. So we talk about why now. And so when we ask ourselves why now, let's look at diabetes. Diabetes is constantly increasing. Diabetes right now grows at around 4.8% a year. If you look around you, the stats for diabetes is staggering. 1 in 3 individuals will most likely develop diabetes. So it's a huge number, and it's becoming a really big problem. I think one of the things that has really brought this to light of the why now is COVID. So with the evolution of COVID, it's accelerated everything in healthcare. It's accelerated telemedicine. It's accelerated virtual care. And it's now provided these conduits where you can now receive care in your home. So you can receive care in your home for your general doctor's visits, but now you can also receive that care in the comfort of your own home for your chronic conditions such as diabetes. And you can do a lot more than these one-time visits, where it's a continuous care model that we employ. Am I muted?
I think you're okay now, Daniel.
Okay. The other area is looking at the cost of diabetes care. And so the cost of diabetes care is significantly on the rise. In speaking with insurance companies, they will tell you that, guess what? The cost of diabetes of an individual living with diabetes is just over $1,200 a year versus that of $300 for an individual that's living with a mental health condition. And so when you look at just the cost of that individual, the cost to the employer's workplace, individuals living with diabetes represent 15% of the cost to employer health benefits spend. And again, these are really big numbers. And so if you just think about the environment where you work, 50% of that health benefit spend goes towards diabetes. 1 in 3 of your coworkers are either diabetic, or they're pre-diabetic, or they most likely will become diabetic. And so when we look at how big this problem is, we ask ourselves, how does digital therapeutics play a role in what we do? And I think what we've been able to go through in this small journey is show how bring the combination of a digital device to provide therapy, including the technology, in layering the human element, layering in the technology that's hidden within our cell phone, our devices, layering in Bluetooth technology, and bringing all these pieces together are able to converge, that provides that healthy outcome to that individual. And when it provides that healthy outcome individual, it allows individuals like Emily to do the things that she wants to do. And the things that she wants to do is go tobogganing, spend time with her family, because these are the things that are the most important to her. So she is no longer spending so much time worrying. She is no longer spending so much time frustrated. She is no longer spending so much time being anxious, being concerned. But it's now put the control back into her hands, where she feels equipped, she feels knowledgeable, her distress levels are down, the anxiety has been reduced, and she feels confident that I can now take this on. And she feels confident because when she needs to do something, she has a mobile app that can help her get through that journey. When she needs to do something, when she has a question, she can lean on that mobile app and have a quick conversation with her diabetes educator. When there's an area of concern, she can go use her phone and send a quick text message. When she is going through her daily life, she has an opportunity to just track her health, track her weight, track her blood glucose, track her blood pressure, track her steps. And all of these things ultimately lead to a better health outcome. And so when we look at health outcomes, we look at opportunities where, after using digital therapeutics in the context of diabetes for a period of 6 months to 12 months, if not longer, Emily is able to see clearly that her A1C, which is a measurement of her blood glucose, has now gone down. She's able to see that she has much better control over her blood pressure. She is able to see that, guess what, my weight, if weight was an issue, is now being managed. She can look at her activity level. She can look at her diabetes distress levels and realize that, wow, I've gained a lot more control. And now Emily's happy, her daughter's happy, and most of all, her husband's happy. You know, they say a happy husband, happy wife. So it just really spells for a really, really great experience for each and every person. This brings me to the end of the conversation. If anyone has any questions that they would like to ask me, be definitely willing to engage you in the conversation. Thank you.
Daniel, that was a brilliant presentation. We do have a question in the chat. The first question is, where do program users come from? Are the services paid by OHIP, extended benefits, or out of pocket?
Great question. So the program users do come from, they generally target employers. So the employers would then cascade it down to their employees. Unfortunately, it's not covered by OHIP yet, but it is covered generally through your extended benefits, or if an individual would like, they would pay out of pocket. I think we're probably, in my estimations, maybe a year to two before we get adoption from the provincial payers, because what they're looking for is empirical data, where a lot of companies that are in the digital therapeutic space are collecting that data to provide back to the payers.
Okay, we have another question. How do we address the inequities in access to digital health services?
Great question. So I think, you know, when you look at health inequities, it's an area where is a great area of concern. It's an area where I've worked myself, and I have a deep interest in, especially when we talk about social determinants of health. I think one of the areas that we have to look at is number one, mobile usage. Number two, the ability to have data or internet usage. And then also the look at cost. And so generally you will find that the populations that you see the inequities more prevalent is generally in the service industries, where they may not have health benefits, or they may not have the best health benefits. I think it's incumbent on organizations that are in this space to make provisions for individuals that aren't able to have access. And in areas like that are, for example, running compassionate programs, whereby it doesn't mean open the floodgates, but it means providing perhaps maybe on a case-by-case basis, or even, for example, opening 10% of your having a representative number. If I have 100 individuals that are paying, allow 10 individuals that are non-paying to again gain access. And the reason why I say that is, again, when you look at underserved populations, those are the populations where you see the prevalence of chronic conditions. Those are the populations where they do not go to their doctors on a regular basis. But that is where chronic conditions left unmanaged becomes a really, really big problem for the health systems.
That was a great answer. Really informative.
Thank you.
We have another question. How does DTX ensure users stay motivated, especially when they relapse?
So I think great question. So you know, one of the things that digital therapeutics does, and I believe it does really well, it's the engagement piece. And so, you know, you can always argue is how much is too much. And so I think everyone in this space is really trying to find that happy medium. But really, where you look at is it's how do I engage individuals at the right time? And so it's important to stay connected to that individual. One of the things that we have found is when you build a relationship with that individual, there's things that they will tell you that they don't tell their primary care provider. And so you listening to that individual and keeping those touch points high when that individual needs the support, and keeping that touch points low when they don't need a support. And so here's where we get into some more very, very complicated things such as predictive analytics. And when we start looking at predictive analytics, we could look at, for example, adherence. If the person has taken their medication 7 days in a row and they don't take their medication on day 8, what's the probability that that individual will stop taking their medication? And so these are the points where predictive analytics will help us gauge this individual is going to relapse. And so it's key to engage the individual when they're going or before they relapse,
So kind of sort of on a related point then, with all this stuff tracking our blood glucose levels or blood pressure or fitness activity 24/7, there's a definite concern about who's got access to our data and what they're going to do with it. So when you're providing a service like this, how do you balance the future or the benefits of this healthcare and consumer privacy?
Yeah, so another great question. Privacy is always a concern for individuals, because here's all my data that's being out in the ecosphere. For us as an organization, everything is blinded. So there's a certain portion of our organization that will actually know who you are. But otherwise, we do mask the identities of every individual and assign them a patient ID number. And that patient ID number, when you look up a record, it's only aggregate data that is put together. So it's not anything that would reveal who you are. So one of the things that we use is, and to do this in healthcare, is if I were to have your health record and I were to look into a crowd, can I pinpoint who you as an individual are? And based on the data that you have in your hand, the answer is no. So I can tell that this is an individual between ages 40 and 49, that they're a female that is diagnosed with diabetes and walks 5,000 steps a day. But if I were to look into a crowd, I cannot definitively define who that individual is. Again, when we look at privacy, we are the data custodians. We do ensure that all our information is PIPEDA compliant. So all the compliance standards with the federal government are there. So again, we do take a high level of pride in ensuring the data privacy and security of all our users.
Great. We have another question here in the chat. How well does digital therapeutics execute the transition from digital to real world when necessary for the patient?
Great question. So one of the things that I showed in the slides before is the psychologist piece. And so in our platform, the psychologist will handle mental health as it relates to the chronic conditions. In the event that there is an exacerbation of a condition, or someone becomes acute, or someone goes into crisis, that falls outside of what our scope of practice is. If that individual is suffering from an acute mental health crisis and they need support, at that point in time, we always refer that individual out to a professional and or to the primary care provider. And it's not just us sort of passing the buck, but that falls outside of the scope of what we do. And we believe that it's important that that individual get the treatment that they do require. And so it's important that A, we loop in their physician, and then also B, loop in that individual. One of the things that we do also within our platform is whenever there's a consult that we do, there is a copy that goes back to the individual's physician, so that physician's always kept apprised as to the progress of their patient.
I personally, I really love the idea of getting real-time advice, when you're dealing with an issue or something, because it creates peace of mind that you checked in with your doctor or dietitian before you do anything.
Right.
And so in the future, do you think AI is going to get so advanced that it would be able to do it automatically? Like you wouldn't have to check in with a real person. You can just do it on your phone.
Yeah. So, that's really, really interesting. And the answer is we're going into that direction. My answer is I don't know if that's necessarily the best direction to go. When we look at a class 2 medical device, as it relates to Canada, a class 2 medical device means that the app can also make a decision for you. And so I think there's certain areas where it's okay for an app to make a decision. And so you will see, for example, in the area of diabetes, where the app advises the individual on insulin adjustments. And so that's the full opposite end of the spectrum when it comes to digital therapeutics. I'm probably a little bit more conservative, where I'd probably pull back a little bit, where I'd want a human intervention when it comes to, for example, making adjustments to medication. But I do believe that when we look at what is a full-blown digital therapeutics and how it's supposed to behave, it's really the app is the one using artificial intelligence, making those decisions for that individual.
That's perfect. Yeah, there's a whole worry of, artificial intelligence not having that human element of empathy, right? You want to connect with another human being. We have another question in the chat. What is your opinion on adding gamification to the therapy?
We've seen that in the space of medication adherence, where they've gamified that experience. I think it works. But again, I think we're still in such an infancy in this space where we're still trying out a lot of things. When you're doing gamification, when it comes to therapy, again, it's really, really important to ensure that you're not revealing someone else's health condition in a game. You're not revealing someone's identity in a game. So for perhaps in a gamification setting, let's look at a Fitbit where there's challenges. So if you can introduce a challenge, it might be a walk challenge, or it might be a step challenge, where something like that, there's an opportunity to gamify that entire experience. I'm not entirely sure about gamifying taking your medication, or gamifying, did you take your insulin today, and then sort of rank you as you're the top in taking your insulin or taking your medication. That's a little bit different, but there's a lot of conversations around providing rewards to individuals, whereby if you've done something for a consecutive amount of time, it'll send you some type of reward or a notification. And in our platform, what we do is there's a celebration that you'll receive, where you'll get a little pop-up that says, hooray, congratulations, great job, woohoo. That's where the gamification experience comes in, where you're essentially playing a game with yourself, but we're not looping in a host of other individuals in that gaming experience.
Perfect. Do we have any other questions in the chat from anyone? Yep, we have another question. Is there a way for patients to interact as to build a community if desired?
So within the context of our application, the answer is no, and I would say no and not yet. There are other apps that are available where they do allow individuals to interact. Again, one of the things that are concerned for us is privacy, because the moment you get into a group setting, it de-anonymizes you as the individual. So we just need to be very careful on how we allow individuals to interact. One of the things that we are looking at is, for example, you would create a username, and that username, we'd have to make sure that your location is not revealed. It also requires someone to moderate those conversations, because it's also very, very important that individual users are not giving medical advice to other individuals in that group setting. So it's something that that we have thought about, but we haven't come up with a solid solution on how to allow that experience to exist.
So, given how quickly technology is changing, where do you think the patient's journey is sort of going to be in 10 to 15 years?
I think 10 to 15 years from now, is there going to be an in-clinic experience? I'm going to say no. I believe that 10 to 15 years from now, the experience will be a fully virtual experience, and fully virtual in a sense that I think we go beyond your mobile device. We go beyond your Zoom call, and we get into elements whereby we can look at augmented reality, where you can have a virtual session with your provider literally in your living room, where you could have that conversation. So am I thinking really, really far ahead? Yes. And that's where I think we will eventually go. But I do believe that more digital experiences are going to happen, especially when it comes to the fact that we're still living in this COVID world. Literally 1 year later, we're still trapped in our homes. We're still unable to go out. And so what I want people to also consider is, what is the mental health impact, right? What is the mental health impact of being literally housed in your house 24 hours a day, right? And so one of the things we're losing is we're losing a lot of social interaction. And so it's really incumbent upon, how do we take therapy and to allow individuals to come back to interacting and then interacting with other humans, and literally beyond the Zoom experience. I look at just the fact that my kids have been limited in their experiences with their friends for literally a year, where I've been working from home for a year. And it gets a little daunting sometimes, right? And so I think we're going to go all the way to we're progressing into one way. But to be pragmatic, I think there's the human side of us will pull things back, because we're still going to want to touch and feel another human being, and stand in front of another human being and laugh and spill my coffee on your papers. We still need those experiences to feel human again.
Yeah, those social elements are so important, and
Yeah.
you missed that with this Zoom environment, like you said.
Right.
We have another question here. What will pharmacovigilance look like in a digital therapeutic environment?
So, great question. And so whoever's asking that question obviously comes from that background, and I'm very, very familiar with pharmacovigilance. So one thing that I will say is, you will see the adverse events spike right through the roof, right? And the reason being is, now we're picking up everything. And so when you look at the context of pharmacovigilance, right now, absent of the digital piece, we report everything. So when you're speaking with a user or a patient, and they say, I dropped my plate while I was going to the kitchen, that is something that we report. Now, when you look at a digital therapeutic environment, the moment that individual has started your therapy, everything becomes reportable. And so we're tracking every single thing. Now, we can track an anomaly. If the blood pressure is too high, it automatically tracks. I think one of the good things about it is that the tracking is going to be so much easier. We're going to be able to, do the intervention in near real time or real time. And so if we see the blood pressure spike, we can have that call with that individual right away. One of the things that we do is, for example, if you check your blood sugar and blood sugar is really, really, really high, our app will ask you to take the blood sugar, will tell you literally, go wash your hands, come back and do it again. In a pharmacovigilance world, that is number one, a reportable event. But number two, it's going to ask what was the remedy, what was done. And so we would put in a report, blood glucose was at 14.5. And then, the individual received a notice, and was it remedied? Individual washed hands, repeated test, blood glucose is at 5.6. So now that issue from a PV standpoint has now been resolved. That was a really technical answer, but I think whoever asked that question understood where I was coming from.
All right, brilliant. Thank you very much for that. Any final questions? Okay, I guess not then. Erin, you want to finish this off?
Sure. If there aren't any more questions, so thank you, Daniel, very much for your presentation this evening. It was incredibly informative. I can tell that you're very passionate about what you do in this topic. So thank you for sharing that with us this evening.
Thank you.
To everyone in the audience, thank you for joining us this evening for our Tech Talks. Our next installation in this series will be happening in June. So keep your eyes on our Brampton Tech Talks meetup group, as well as the Brampton Library events calendar for further details about the next speaker and topic. And we look forward to seeing you there.
Thank you, everyone. This was a great opportunity to just connect with everyone and present, and more importantly, just hear some of the questions that came through. They were really, really enlightening. This is a topic that I can talk on for hours and hours and hours. It's something that I do enjoy. If anyone does want to speak with me, my email address is there in the chat, and I would definitely love to continue conversations as it relates to digital therapeutics. What does it look like today? What does it look like 5 years from now? What does it look like 10 years from now? And because there's just so much happening. And again, I'll always come back to thank you, COVID, right? So COVID has done some really, really good things, and then COVID has done some really, really bad things. But I think really at the end of the day is when we look at healthcare. Healthcare and education have been the last two things to transition into the digital world, and it's created so many opportunities for us out there. And you're looking at, and every day you see so many new companies coming out in a digital therapeutic space, in a digital healthcare space, in technology and in education, really addressing core problems. I think, as we see more and more people address some of these really, really, really big problems, we're going to see so much innovation. And we've already seen so much innovation in this space within the last 12 months.
Absolutely.
Yeah.
All right. So thank you so much again, Daniel. We appreciate it. Just to note to anyone who may have joined us a little bit late, this talk has been recorded and we will post it to the Brampton Library YouTube channel at a later date. So keep your eyes peeled there if you happen to miss some of tonight's presentation. Thank you everyone for spending time with us this evening. Thank you, Daniel. Thank you, Zaim. And we'll look forward to seeing you at our next Brampton Tech Talk.
Thank you.
Take care, everyone, and stay safe.